This is a 7-year-old girl who got an injury in the right forearm about 4 weeks ago. So he went to traditional bone setters and they have been massaging with local herbs, and unfortunately she got a malunion. So she came presenting with a deformity, as you can see critically in that forearm. Then also the functionality of the forearm had reduced, and of course pain, because during these repetitive massages and manipulations, you keep on renewing the inflammation, which comes with pain, the swelling, and so on. So today we want to see what malunion is, and then get to digest it and see how we can maneuver around it. Remember, the forearm has two joints that bound it. That is the elbow proximally and the wrist distally. So these two joints have different ranges of motions, which they perform in different planes, so that the forearm can be able to perform its functions. In addition, it also has to supinate and pronate, whereby these two bones in the forearm, that is the radius and the ulnar, have to slide over each other or have to rotate in different planes as you supinate and as you pronate. There is also what we call a carrying angle, which is that degree of lateral deviation from the elbow, which has to be preserved as we are treating these forearm injuries, especially those ones which involve the elbow joint. So all these factors have to be put in consideration as when we are managing the forearm injuries, so that we can preserve its functionality. So this is the X-ray before us of the forearm that we are just discussing here. And before us are the two views, that is the AP and lateral. The AP on our right and the lateral on our left. So I trust we can all differentiate what the radius and what the ulnar is according to the previous videos. And you can appreciate that chunk of callus where the fractures were, or where the fractures happened previously. So remember, the rate of fracture healing is faster in children, as they still have a faster rate of cell division compared to the adults. That's why you can have such a bigger chunk at just 4 weeks. So we can appreciate the rotations and the undulations where the fracture sites happened, and these led to the bending of the previously straight bones. So remember, in the forearm we have these two movements, that is the supination and pronation. And when the previously straight bone becomes undulated like this, it will impede on these two movements when the bone is trying to slide over the other as they supinate and pronate. And this will impede on the other rotation, which is usually needed when, let's say, someone is trying to open the door handle, trying to rotate keys, let's say in a lock, and so on and so forth. Remember, the extent to which this malunion affects the functionality of this forearm is also dependent on the degree of rotation and undulation. So not every undulation or rotation will manifest clinically much as it can be seen radiologically. So a particular degree of undulation and rotation will be a determinant for whether it will be clinically impeding the functionality, or it will be visibly seen when the patient presents to us at the clinic. So other features which can usually manifest with malunion. Remember, malunion is when those two or more bone fragments do not unite in a way that is anatomically acceptable. So when those fragments usually don't unite in a way that is not acceptable, some other features can manifest as well. We can usually, on top of the deformity, there could be pain or not, depending on the strength of the callus that is joining the two bones. We may have arthritis if at all the fracture impeded on the articular surface within a joint. Then sometimes we can have nerve irritations. Let's say we have this chunk of callus and it is encroaching on the layers of the nerve or compressing it in one or the other. So patient can present with some neuropathies. So we can have also muscle weaknesses because this limb, which is not properly used, the muscles will undergo atrophy. So muscles which are not used properly will of course weaken, and this will bring about the muscle weakness. So these and very many other complications and manifestations of malunion can be prevented and should be prevented by you seeking health care from health centers and those specialized hospitals, so that you don't come up with these, because they will be costly and sometimes the correction may not be the best. Thank you.